I also wanted to talk to you about opt-out advocacy. Um, this is a really important change, which will come into place on the 1st of September, when the Mental Health and Wellbeing Act commences. It's really important to us as consumers, because being treated against our will is a real situation of power being exerted over us. And for some people, feeling powerless and helpless, and not knowing what they can do. And advocates can help with this. At the moment, for people being treated against their will, advocacy is opt-in. So you choose to have an advocate if you want. As of 1st of September, advocacy for people being treated against their will be opt-out. And this means you will automatically get an advocate. But of course, you don't have to have the advocate. You can opt out by saying no, thank you. But nonetheless, it's a big change to be opt-out. So where we're positioned on this is supporting our allies at IMHA, Independent Mental Health Advocacy, who do the advocacy for people being treated against their will. And I related to that, this Tuesday, our chair of our Committee of Management, James Horton, and I met with Minister Gabrielle Williams, the Minister for Mental Health. And we discussed this with her because we're greatly concerned that the funds are yet to be released, and this needs to commence on September the 1st. And in comparison, there's big shiny things happening in the reform, like the Victorian Collaborative Centre, the statewide trauma service, and we're a bit concerned that something that's really needed for consumers hasn't had the money released yet from Treasury. And we are hoping that this happens as soon as possible so that this service can be up and running. So next steps for us, because we've had that conversation with the department and also with the minister, next steps for us is supporting IMHA as needed around that, and also being ready to participate in the co-design of that opt-out service. So there's a few sort of technicalities around that opt-out as well. So for some of you watching this, I know you might not want your advocacy done by IMHA, for example. So there's work going on to make sure that you have choice there as well. So yeah, wanted to let you know that as well. But looking forward to the next steps, which is hopefully that the funding is released, and then we can participate in the co-design of that service, so that it's an absolute amazing support for anyone who wants to have it.